What do you do when a toenail becomes so deformed and curled it's creating unstoppable pain? This is what we're going to show you in this video on how we remove this toenail. And it's a permanent removal so that it doesn't come back. Unfortunately, antifungals, topical solutions, or gels or creams won't fix this problem. So what we're doing here is numbing the toe. I'm going to rest my hand on top of your foot, cold spray, and a little pinch. You didn't even feel it. And surprisingly, this does not hurt as bad as you think it would. We use a small needle. It's a 27 gauge needle. And by introducing the fluid very slowly into the toe, it reduces the pain. So the needle stick that we're doing here is minimized with the use of cold spray. And that's what you're seeing here. After we spray the cold spray, then we do the needle stick, and that's greatly reduced by this cold spray. After that, we'll gently introduce the fluid into the toe by gradually pressing on that syringe, putting it in there nice and slow, and that's going to help reduce the pain that the patient's experiencing. Usually it's due to the fluid, not the actual needle stick. So as you can see here, this patient hardly even reacted to this. So when you're removing one of these, you have to remember it's not an infection in the toenail. It's basically a deformed toenail that could have came from trauma. It could be fungus. In this case, this patient suffered trauma to the toenail many years ago, and you can see how deformed it is. It's curled. They can't cut it because it becomes thick, and that one corner, the medial border or the inside border of the toenail, is curving and pressing into the skin, and that's what's causing most of the pain. Also, it's so thick that shoes just rub on it and create severe pain as a result of the thickness and the pressure. So we elected to have it permanently removed, and that's what we're doing here. So we're freeing up the toenail. You free the cuticle area or the eponychium from the nail plate, which is obviously the toenail. And then after that's freed up, we will use an instrument. In this case, we're using a nail nipper because we can grab onto the toenail. It's going to be gently removed from the underlying nail bed and pulled out. And you'll see we're ensuring that we get that proximal portion, or this area where the cells for the matrix is, which is the cells that grow the toenail. We want to make sure we get those out so that we can then introduce a chemical in there to stop it from coming back. So if you take a look here, you're going to see how that nail was severely curled and bent around where it was putting pressure onto the nail fold. So we had to get that out of there. You can cut it, you can temporarily remove it, but because the cells that grow the toenail have a memory, it's going to grow back exactly the same way and cause the same problem. It'll be curled, it'll cause pain to that area. So you can see where that nail was pushing into the skin there. You can see that groove where the nail was growing in. So what I'm doing here now is introducing phenol. This is a chemical that's going to stop the nail from growing back. It's creating a burn and stopping those cells from growing that toenail. So we'll do 3 applications of this. So what are some other options we could have done for this? What are some conservative options? Well, you can trim the toenail. We have special burrs that we use to thin the toenail, as well as we can trim that corner, but it's going to continue to grow that way. And it's very painful to have this done. A lot of times when we're just trimming the toenail in the office or burning it down, the patient experiences pain. So that's not an ideal way of handling this. So another way is you can put a topical cream on. There's something called urea cream. It's a 40% cream that you can apply to the toenail and cover it with an occlusive dressing such as a Band-Aid or moleskin, and that will soften the toenail, and then over time it will fall off. But again, you have to remember it's going to come back the same way because there's permanent damage. So typically patients will elect to have it permanently removed, as we're doing in this situation. So how do you know if you need to have yours removed? Well, usually we base this on pain. If the patient's having a severe amount of pain from the toenail, then we'll talk about all of the options, but usually permanent removal is the best way to handle this. So after the procedure, the recovery can be anywhere from 2 to 4 weeks. It takes a couple weeks for that burn to calm down. It turns into a wound, and during that time period, you're soaking it in warm water and Epsom salts using Neosporin and a Band-Aid. We're applying a thick gauze bandage today. That tourniquet then gets removed after the bandage goes on. And this bandage will control some of our bleeding. And then in 24 hours, we're going to have our patients start soaking it in warm water and Epsom salts, or they can use warm water and an antibacterial soap, such as a Dawn dish soap, as long as it's antibacterial. And that's going to facilitate drainage and help to keep that nail bed area clean so that we can put our bandaging on, a Neosporin and a Band-Aid. And then after about 2 to 4 weeks, it's usually resolved. The patient can really, in 48 hours, resume all activities. They can start running at that point in time. I don't usually do any restrictions for this. And typically, these are scheduled in the office. Sometimes if there's an infection, like an underlying bacterial infection, we'll do it that same day. But this particular patient was scheduled. It was a severe thickened toenail, and the plan was just to remove it permanently. So here you can see it here, how curled and thick it was, and that portion was growing into the skin. If you have any questions about this, drop them in the comments section below. If there's anything else you want to learn about deformed or ingrown toenails, please drop it in the comments section below.